7 Deadly Cancer Signs in Seniors You Must Never Ignore. Hello and welcome. Today, we're diving into the most common cancers affecting older adults, a topic that's more important than ever as our population ages. Did you know that over 2/3 of new cancer cases occur in people aged 60 and older? The median age at diagnosis is 66. That's why cancer awareness among seniors is crucial. Aging brings a higher cancer risk due to years of exposure to harmful factors and a weakening immune system. Add in other health conditions like diabetes or heart disease, and cancer becomes even more complex in older adults. Early detection can save lives. We'll highlight key warning signs and explain how cancer often shows up differently in seniors. Treatment isn't just about age, it's about overall health, mobility, and personal goals. Today's cancer care is more personalized than ever, focusing on both survival and quality of life. In this video, we'll explore the top cancers affecting seniors, their risks, symptoms, and treatment options, so you can stay informed and prepared. Let's get started. 1. Bladder cancer. Bladder cancer represents one of the most significant cancer concerns for elderly populations, particularly men. More than 70% of all bladder cancer cases affect men between ages 50 and 80. This striking statistic highlights the importance of bladder health awareness as we age. The bladder, a hollow organ in the lower abdomen that stores urine, becomes increasingly vulnerable to cancer-causing agents over time. Years of exposure to carcinogens that are filtered through the kidneys and concentrated in the bladder can damage the organ's protective lining. This accumulated damage explains why bladder cancer is predominantly a disease of older adults. Recognizing the warning signs of bladder cancer is crucial for early detection. The most common symptoms include frequent urination and burning sensations during urination. Blood in the urine, even if intermittent or painless, should never be ignored as it's a classic bladder cancer warning sign. Other potential symptoms that elderly individuals and their caregivers should watch for include pelvic pain and a distended bladder. Some patients may experience urinary urgency or feel the need to urinate but produce little output. These symptoms can significantly impact quality of life and should prompt a medical evaluation. Risk factors for bladder cancer extend beyond age and gender. Smoking remains the single greatest risk factor, responsible for approximately half of all cases. The chemicals in tobacco smoke enter the bloodstream, are filtered by the kidneys, and ultimately come in contact with the bladder lining, causing damage over time. Chronic bladder inflammation, whether from recurrent urinary tract infections or long-term catheter use, may also increase bladder cancer risk in elderly individuals. Parasitic infections, though rare in developed countries, contribute to bladder cancer rates globally. Certain medications, such as the diabetes drug pioglitazone and chemotherapy medications like cyclophosphamide, have also been linked to increased risk. Diagnosis of bladder cancer typically begins with urinalysis to check for blood and other abnormalities. Cystoscopy, a procedure that allows doctors to examine the bladder lining directly, serves as the gold standard for diagnosis. During this procedure, suspicious areas can be biopsied to confirm cancer presence. Treatment approaches for elderly bladder cancer patients vary based on the disease stage and the patient's overall health. For non-muscle invasive cancers, transurethral resection followed by intravesical therapy often proves effective. More advanced cases may require radical cystectomy, bladder removal, or combinations of chemotherapy and radiation. 2. Lung cancer. Lung cancer stands as one of the most prevalent and deadly malignancies affecting elderly populations worldwide. More than 80% of all lung cancer cases affect adults age 60 or older, making it primarily a disease of the elderly. This staggering statistic underscores the importance of lung cancer awareness among seniors and their healthcare providers. The high incidence of lung cancer in the elderly stems from multiple factors, with smoking history being the most significant. Many current seniors grew up in eras when smoking was commonplace and its dangers not fully understood. Long-term exposure to tobacco smoke causes progressive damage to lung tissue that can eventually lead to cancerous changes. Even for elderly individuals who never smoked, risk factors abound. Exposure to secondhand smoke, radon gas, asbestos, air pollution, and other environmental carcinogens can accumulate over decades. These exposures, combined with the natural aging of lung tissue, create perfect conditions for cancer development in later years. The warning signs of lung cancer can be subtle initially but become more pronounced as the disease progresses. A persistent cough that worsens or changes in character deserves medical attention, especially in elderly smokers or former smokers. Chest pain that intensifies with deep breathing, coughing, or laughing should never be dismissed as simply getting older. Hemoptysis, or coughing up blood, represents one of the most alarming symptoms of lung cancer. Even small amounts of blood in sputum warrant immediate medical evaluation. Shortness of breath with minimal exertion, when new or worsening, may signal lung cancer rather than normal aging or deconditioning. Chronic respiratory infections like bronchitis or pneumonia that recur or fail to resolve completely with treatment can indicate underlying lung cancer. Elderly patients may attribute fatigue, weight loss, or decreased appetite to aging, when these could actually be systemic symptoms of lung malignancy. Voice hoarseness, facial swelling, or new onset of shoulder or arm pain may indicate advanced disease affecting surrounding structures. Early detection greatly improves lung cancer outcomes, even in seniors. Low-dose CT scans are now recommended for high-risk individuals, helping detect cancer earlier than chest X-rays. Diagnosis involves imaging and tissue sampling, with doctors choosing methods based on lesion location and patient health. Options include bronchoscopy, needle biopsy, or surgery. Treatment has advanced for elderly patients. Surgery is preferred for early-stage cancer, with minimally invasive methods easing recovery. SBRT offers a non-surgical alternative. For advanced cases, targeted and immune therapies provide effective, better-tolerated options than chemo. Quality of life is now a key factor in treatment choices for older adults. 3. Pancreatic cancer. Pancreatic cancer represents one of the most challenging malignancies affecting the elderly population, with most cases diagnosed in adults age 65 or older. This cancer begins in the pancreas, a vital organ that produces digestive enzymes and hormones like insulin that regulate blood sugar. The disease's tendency to remain silent until reaching advanced stages makes it particularly dangerous for seniors. The relationship between aging and pancreatic cancer risk involves multiple factors. Decades of exposure to carcinogens, accumulated genetic mutations, and age-related changes in pancreatic tissue all contribute to increased vulnerability. Additionally, conditions more common in seniors, such as long-standing diabetes, chronic pancreatitis, and obesity, further elevate risk in this population. Detecting pancreatic cancer early presents significant challenges, as symptoms typically don't appear until the disease has progressed. When symptoms do emerge, they're often vague and easily attributed to other conditions common in the elderly. This diagnostic challenge explains why pancreatic cancer is frequently discovered at advanced stages when treatment options become more limited. One potential early warning sign is sudden-onset diabetes in elderly individuals with no previous history of the condition. When diabetes appears unexpectedly in seniors, especially when accompanied by weight loss despite normal or decreased appetite, healthcare providers should consider pancreatic cancer screening. This connection exists because growing tumors can impair the pancreas's ability to produce insulin properly. Jaundice, yellowing of the skin and eyes, represents another critical warning sign that should never be ignored in elderly patients. This symptom occurs when a pancreatic tumor blocks the bile duct, preventing bile from reaching the intestines. The resulting buildup of bilirubin in the bloodstream causes the characteristic yellow discoloration of tissues. Other symptoms that may signal pancreatic cancer include unexplained weight loss, loss of appetite, and changes in taste or smell. Pale or clay-colored stools can result from bile duct obstruction, while dark, tarry stools may indicate bleeding in the digestive tract. Persistent upper abdominal pain that radiates to the back is another concerning symptom in elderly individuals. Some pancreatic cancer patients experience unusual symptoms like itchy hands and feet, which stem from bile salt accumulation in tissues. Fatigue, depression, and blood clots may also occur as the disease progresses. For elderly patients especially, these symptoms can be mistakenly attributed to aging rather than investigated as potential cancer signs. Diagnosis often starts with imaging like CT, MRI, or endoscopic ultrasound to detect pancreatic masses and assess spread. A biopsy confirms the diagnosis, though it's difficult due to the pancreas's deep location. Treatment for elderly patients must weigh benefits against risks and quality of life. Surgery is potentially curative, but may not suit frail or advanced stage patients. Improved techniques have made surgery safer for some seniors. For those who can't have surgery, care focuses on survival and comfort. Chemotherapy is now better tailored to older adults, and radiation, sometimes with chemo, can help manage symptoms and slow the disease. 4. Breast cancer. Breast cancer incidence rises dramatically with age, making it a significant health concern for elderly women. Statistics reveal that the incidence of breast cancer among women aged 65 and older is 1.7 times higher than among women between 45 and 64, and a remarkable 10 times higher than among women younger than 45. These numbers underscore why breast health awareness remains crucial throughout a woman's life, including her senior years. The relationship between aging and breast cancer risk involves multiple biological factors. Cumulative exposure to estrogen over decades, accumulated genetic damage from environmental exposures, and age-related changes in breast tissue all contribute to increased vulnerability. Additionally, the natural weakening of the immune system with age reduces the body's ability to identify and eliminate abnormal cells before they develop into cancer. For elderly women, recognizing breast cancer's warning signs can lead to earlier diagnosis and better outcomes. The most common symptom remains a new lump in the breast or armpit, though not all lumps are cancerous. Any new breast mass in an elderly woman deserves prompt medical evaluation, regardless of whether she continues to undergo routine screening mammography. Changes in breast appearance or texture may also signal breast cancer in senior women. These changes include swelling, dimpling, puckering, or redness of the breast skin. Some women describe the skin texture as resembling an orange peel, a condition doctors call peau d'orange. Such changes should never be dismissed as merely age-related. Nipple changes represent another important category of symptoms. These might include nipple retraction, turning inward, spontaneous discharge, crusting, or scaling. Pain in the nipple or breast, while less common than in benign conditions, can occasionally indicate cancer. For elderly women, any persistent breast symptom warrants medical attention. Screening recommendations for breast cancer in elderly women generate considerable debate among experts. While mammography undoubtedly saves lives, its benefits and risks shift with advancing age. Most guidelines suggest continuing screening mammography until age 75 for women in good health, with decisions beyond that age made individually based on life expectancy and personal preferences. Breast cancer diagnosis in elderly women follows similar steps as in younger patients, starting with exams and imaging, followed by a biopsy. Imaging helps assess cancer spread before treatment planning. Treatment options include lumpectomy or mastectomy, with reconstruction possible. For older patients, decisions often factor in quality of life as well as survival. Most elderly patients have estrogen receptor-positive cancers, making hormone therapies like tamoxifen or aromatase inhibitors effective and better tolerated than chemotherapy. 5. Prostate cancer. Prostate cancer represents one of the most common malignancies affecting elderly men, with more than 50% of all cases diagnosed in men aged 75 or older. This statistic highlights the strong association between aging and prostate cancer risk. The prostate gland, which produces seminal fluid that nourishes and transports sperm, becomes increasingly vulnerable to cancerous changes as men age. The relationship between aging and prostate cancer involves complex biological mechanisms. Accumulated genetic mutations, hormonal changes, and inflammatory processes that occur over decades all contribute to increased risk. By age 80, autopsy studies suggest that the majority of men have some cancerous cells in their prostate, though many of these never progress to clinically significant disease. Unlike many other cancers, early-stage prostate cancer rarely causes noticeable symptoms. Most cases are now discovered through prostate-specific antigen, PSA blood testing before symptoms develop. This screening approach has significantly changed the landscape of prostate cancer diagnosis, particularly for elderly men who previously might have remained undiagnosed. When symptoms do occur, they typically result from the enlarging tumor pressing on the urethra or nearby structures. Frequent urination, especially at night, may signal prostate problems in elderly men. Difficulty starting or holding back urination, weak or interrupted urine flow, and burning sensations during urination represent other urinary symptoms that warrant medical evaluation. Some elderly men with advanced prostate cancer experience blood in their urine or semen. Painful ejaculation or general discomfort in the pelvic region, lower back, or upper thighs may also occur as the disease progresses. Erectile dysfunction, while having many potential causes in elderly men, sometimes results from prostate cancer affecting surrounding nerves. Diagnosis starts with a PSA test and digital rectal exam. If results are abnormal, imaging, like MRI, and a targeted biopsy follow. These steps improve accuracy and reduce risks for older patients. For elderly men with low-risk prostate cancer, active surveillance, with regular monitoring, is often preferred over immediate treatment to preserve quality of life. If treatment is needed, options include surgery, often with robotic assistance, radiation therapy, external or internal, and hormone therapy for advanced cases. Newer drugs also help manage metastatic disease while maintaining life quality. 6. Colorectal cancer. Colorectal cancer ranks among the most common malignancies affecting elderly populations worldwide, with incidence rates rising steadily after age 50. By age 70, the risk increases significantly, making this cancer a major health concern for seniors. The disease develops in the colon or rectum, usually beginning as small, benign polyps that can transform into cancer over time. The aging process creates multiple vulnerabilities in the colorectal tract that contribute to cancer risk. Decades of exposure to dietary carcinogens, accumulated damage from inflammatory processes, and age-related changes in the intestinal microbiome all play roles in cancer development. Additionally, the protective mechanisms that repair DNA damage and eliminate abnormal cells become less efficient with advancing age. Recognizing colorectal cancer symptoms can lead to earlier diagnosis and better outcomes for elderly patients. Changes in bowel habits, including persistent diarrhea, constipation, or narrowing of stools, represent important warning signs. These changes, when lasting more than a few weeks, warrant medical evaluation rather than self-treatment with over-the-counter remedies. Rectal bleeding or blood in the stool, even if intermittent or minimal, should never be dismissed as merely hemorrhoids in elderly individuals. While hemorrhoids commonly cause bleeding, this symptom requires proper medical assessment to rule out cancer. Dark, tarry stools may indicate bleeding from higher in the digestive tract and also deserve prompt attention. Abdominal discomfort, such as frequent gas pain, bloating, or cramps, can signal colorectal cancer in seniors. Unexplained weight loss, fatigue, or a feeling that the bowel doesn't empty completely after a bowel movement represent other potential symptoms. Some elderly patients experience a sensation of abdominal fullness even after not eating for hours. Colorectal cancer diagnosis typically includes a colonoscopy with biopsy and imaging like CT scans to assess cancer spread. In elderly patients, doctors consider other health conditions and functional status before proceeding. Treatment has adapted to seniors' needs. Surgery is key for localized disease, often using minimally invasive techniques to aid recovery. Advanced cases may involve chemotherapy, with dose adjustments, and targeted therapies, aiming for effective cancer control with minimal side effects. Quality of life and functional preservation are central in treatment planning. 7. Skin cancer. Skin cancer represents the most common malignancy in elderly populations, reflecting a lifetime of sun exposure and accumulated DNA damage. By age 65, many individuals have received substantial ultraviolet radiation exposure, often from eras when sun protection awareness was limited. This cumulative exposure explains why skin cancer incidence increases dramatically with age. The three main types of skin cancer affect elderly individuals at different rates and with varying levels of concern. Basal cell carcinoma, BCC, occurs most frequently, typically developing on sun-exposed areas like the face and neck. Squamous cell carcinoma, SCC, represents the second most common type, also appearing predominantly on sun-damaged skin. Melanoma, while less common, poses the greatest danger due to its potential for rapid spread. For seniors, skin cancer risk factors extend beyond sun exposure. Age-related thinning of the skin provides less natural protection against UV damage. Declining immune function reduces the body's ability to identify and eliminate abnormal skin cells. Certain medications common in elderly populations can increase sun sensitivity, further elevating risk. Recognizing skin cancer signs is vital for older adults. The ABCDE rule helps spot melanoma, asymmetry, irregular borders, varied color, diameter over 6 mm, and evolution of a mole. See a dermatologist if these appear. For basal and squamous cell cancers, look for non-healing sores, pearly bumps, or crusty lesions, especially on sun-exposed skin. Don't ignore itching or bleeding. Seek medical advice. Regular skin checks are important with age. Since some seniors may struggle with self-checks due to mobility or vision issues, caregivers and doctors should help ensure routine screenings. Skin cancer diagnosis in the elderly begins with a visual exam, often followed by a biopsy. Doctors consider age-related factors like healing and other health conditions when choosing biopsy methods. Treatment options have expanded. Surgical removal, especially Mohs surgery, is effective for most non-melanoma cancers. For those unable to have surgery, alternatives include topical therapies, radiation, photodynamic therapy, and cryotherapy. Treatment choice depends on cancer type, location, overall health, and ability to manage recovery. Prevention remains important. Seniors should use sunscreen, wear protective clothing, avoid peak sun, and may benefit from vitamin B3 nicotinamide to reduce new skin cancers. Thank you for watching. Hit that like button, subscribe for more health tips, and share this video with someone you care about. Stay healthy, stay informed.